Thank you, Mr. Speaker. Colleagues, as you may know, I'm a nurse. I've also been a fierce advocate for expanding access to quality health care for all Oregonians. Senate Bill 1578 continues that effort by addressing a key inequity in our healthcare system. According to the 2018 American Community Survey, nearly 1/5 of our state population speak a language other than English at home, and nearly 40% of that population say they do not speak English very well. However, our healthcare interpreter system is far from where it needs to be to thoroughly serve our limited English-speaking population. Most healthcare interpreters in Oregon work as independent contractors for for-profit language service companies. Several of them report low pay, no healthcare or benefits, no mileage reimbursements when they travel far lengths, and high turnover. To make matters worse, CCOs reported that only 5% of appointments were filled by interpreters credentialed by the OHA last quarter. Senate Bill 1578B addresses these issues by bolstering the healthcare interpreter workforce, giving interpreters more agency over their compensation, giving providers more agency over their language service contracts, and inadvertently increasing access to quality healthcare. More specifically, the bill directs the Oregon Health Authority to secure a contract with an existing interpreter management system that has the capability to have providers schedule appointments directly with interpreters, as well as invoicing and billing functions. Second, the bill directs the OHA to contract with a nonprofit organization that works with certified and qualified healthcare interpreters to deploy a recruitment and retention program that will aid in filling appointments with healthcare interpreters who have been credentialed by the OHA. Additionally, the nonprofit will be required to report back to the OHA on their progress in filling appointments. This is critical. We have a duty under the Civil Rights Act of 1964 to ensure that limited English-speaking patients have access to quality interpretation services, and as we know, we are incredibly behind in doing just that. With the program dedicated to workforce development, we will be able to fill more appointments with credentialed interpreters. And third, this bill directs the OHA to take all steps necessary to secure federal financial assistance for directly reimbursing healthcare interpreters for healthcare interpretation services provided to Oregon Health Plan members. Currently, Medicaid reimburses healthcare interpretation services at a flat $60 an hour rate, no matter how rare or common your language is. Also, our current system doesn't allow for interpreters to be paid directly. With SB 1578B, we have an opportunity to create a reimbursement fee structure based on the demand of the language and pay interpreters directly. Our legislative counterparts in Washington State moved toward a similar state-based interpreter management system model, and after implementation, Washington saw great success with wages rising about $20 an hour on average, in addition to saving $3 million a biennium in administrative costs. To be clear, SB 1578 does not create a monopoly for the nonprofit. Private language service companies are still allowed to operate freely. This bill just provides workers with an opportunity to seek lower cost access to a scheduling portal versus relying on private companies. There is no mandate in the bill that interpreters use the OHA system. Furthermore, the state-based interpreter management system will only be servicing Oregon Health Plan enrollees, which is just a fraction of the appointments that take place in Oregon. On another note, I think it's important to state that these interpreters became covered by AFSCME in 2019 after this body passed a bill which gave medical interpreters collective bargaining rights under PECPA. Oregon AFSCME is already bargaining with the state and is close to finalizing the contract, which will be similar to the one negotiated between the state and AFSCME Local 132, which represents registered licensed child care providers who take clients that receive ERDC subsidies. In closing, here in Oregon, we will be able to accomplish setting this system up with an estimated $1.37 million and the addition of 4 full-time employees. Colleagues, This modest investment in our healthcare interpreter system will not only benefit the thousands in our interpreter workforce, but also the hundreds of thousands of Oregonians with limited English proficiency. I urge you to cast an aye vote in support of Senate Bill 1578B. Thank you.